Hi, I'm Dr. Kenny Siporin, and I just got back from a medical mission in Jinotega, Nicaragua. And I'd like to just share my thoughts about this last trip. This trip was a little bit different, where we usually see a majority of children. This trip was notable for kind of a balance in the type of cases that we saw. We saw some extreme cases where we really couldn't do anything. We needed to take these people back to the United States in order to give them the proper treatment. So we had people that we had to leave alone and try to make plans to bring back to America to get the treatment that they actually need. We saw a lot of minor cases, and we saw a couple children. We did some cleft lips and some cleft palates. But in this trip we did a lot more of your basic bread and butter plastic surgery, such as skin cancers and tumors and scar revisions. Somebody in my office, when I got back to the office, a little bit reinvigorated and refreshed, but also a little bit tired from the trip, they said, "What was your favorite case?" And kind of paused for a while, because even though I've been asked that question many times, I suppose I haven't thought too clearly about it. But the reality is, my favorite case is the case in which the patient gets the most satisfaction out of that procedure. And I think my most recent trip to Jinotega is a very good illustration of that. You don't have to do a major craniofacial reconstructive case to make a tremendous impact on the life of a patient. I especially enjoy going to third world countries because it gives me a great sense of perspective. An interesting thing about Nicaragua is it seems as if everybody is equipped with a machete, because I saw a number of machete-induced traumatic injuries, including traumatic amputation of a hand and an ear. So I did an ear reconstruction on that patient, and I did a number of smaller types of procedures, but I felt they were equally as dramatic and beneficial for the patients. I did a couple of scar revisions on the face, near the eyes, and on the nose and on the cheeks in patients who had been attacked by machetes. It's easy to think or feel that the major craniofacial reconstructions are the more dramatic procedures, but the truth of the matter is we can make a dramatic improvement in the lives of people with less outrageous types of traumatic injuries, and I think that in Jinotega this year we accomplished that. We have shown a wonderful example of how sometimes doing a very small procedure can make a wonderful difference in someone's life. This year I had the opportunity to see in 1 year follow-up a 75-year-old woman whom we did the primary cleft lip repair last year when we were in Esteli, Nicaragua. And perhaps that was one of the highlights of this trip, when I saw that woman and her family, and she embraced us enthusiastically, and we were able to do the probably most important finishing touch that we can do on that 75-year-old woman, which was provide her with a set of dentures, so that not only does she look normal now, but now she can eat a normal diet as well. And although sometimes these trips can be difficult, and quite honestly, at times I say to myself, I can't wait until this is over, because the workload is so tremendous and it can be emotionally draining. There's no doubt that I return home with a whole new sense of purpose and perspective and appreciation for the things that I have here in the United States. And as much as it's nice to help people that are less fortunate than us, I have to admit, in a selfish way, I get something out of going to third world countries because it keeps me grounded and helps me put things in perspective and keep a level head.